Hello everyone, Dr. Sam Schroetke here at Physical Therapy and Hand Clinic of Hillsboro with a very exciting edition of Technique Tuesday. And you're probably asking yourself, where are we? Because you don't see our red wall. And it's just because for this particular technique, we need a corner, preferably, okay, in order to do this technique. So this is called mobilization with movement for lateral elbow pain. So if you've been diagnosed, if you're having pain on the outside of the elbow, could be tennis elbow, lateral epicondylitis, or maybe even the joint. Pain in this region, this technique might work for you. We've already done 4 previous videos on lateral elbow pain. This is an alternative to those, okay? So find a wall, okay? And then basically I'm going to take the outside of my elbow. So here's the joint, basically, or that little knobby part there. I'm going to go a little above that. And I'm going to put that against the wall, okay? And I would do this because it makes it a little more comfortable, okay? So go above the joint here, and then with my other hand, I'm going to go, there's the other knobby bone here, the medial epicondyle. I'm actually going to go distal or farther down than that. So I'm kind of, this is above the joint, this is below the joint, okay? And then I'm going to put a glide. It's called a lateral glide, but I'm essentially just going this way. I'm pushing into the wall, and I'm pushing this way with this hand. Okay. So one more thing. So 2 towels. So again, a little above the bone. What I would encourage you to do, usually when you have lateral elbow pain or tennis elbow, gripping is one of the painful things, and so this is actually to help improve the grip. All right, so here I am. So I would grab something to squeeze, basically. All right, so web space-ish, a little below the joint. I'm pushing into the wall, and I'm pushing this way. I hold that, and then squeeze. And you do 3 sets of 10. You do 10 reps. It should be 100% pain-free. If it is not, don't do it, or we have to do an alternative. So sometimes what you'll find is you're pushing here, and it's maybe a little better, but not quite, or maybe it's not better at all. Alter your angle, okay? So we start lateral. Maybe that's not quite doing it. Alter the angle a bit. And actually, I do have lateral elbow pain right now. This doesn't help me, but I would say the most people this does help. If I do this, see I just drop my elbow a little bit, constant pressure, now I can do my reps, no problem, okay? I do 10 of them, rest a minute, set it up again, 10 of them, rest a minute, another set of 10. So you do 3 sets of 10. When you get done, test. It should feel better. If you're 100% pain-free when you do it, and you're just a little better, that's okay, as long as it's 100% pain-free when you do it. But I would do 3 sets of 10 a couple times a day, and do it for an extended period of time, a couple of weeks actually, okay? So, one more time. I'm just going to show you one more time. Towel there, you go above the elbow joint, you're holding something to squeeze, below the elbow joint, underhand grip, and you're pushing this way. Start lateral, and then the squeeze. This is constant pressure. If it's painful, alter your angle. If it can't be pain-free when you do it, then don't do it at all. Okay? But you should be able to find some kind of angle that is pain-free and test it when you're done. However, here's a modification. Some people, if they have their elbow bent a little bit, they can do it pain-free. That might be a modification. You have to do it first. Okay? We want it pain-free. So if, say I couldn't do it with my elbow straight, it just hurt every time, no matter what angle I did, I would have the angle slightly bent, elbow slightly bent. Same thing, I'm doing the mobilization and then squeeze. If that's pain-free, do your 3 sets of 10. You might have to stick here for a while, for a couple of days, but as time goes on, you try to get that elbow a little straighter. As time goes on, a little straighter. As time goes on, a little straighter. But give it a couple of days, okay? So actually for me, this does hurt a little bit unless I angle it here. Or I could do this, okay? If you can do it with your elbow straight, it's better. But if you have to start with a little bit of bend, that's okay. All right? It's a little bit more of a complicated technique, but it can be pretty effective if the other ones we demonstrated weren't working. Give this one a go around. But you should test, and it should feel better when you're done. All right. I'm Dr. Sam Schroetke here, Physical Therapy and Hand Clinic of Hillsboro. Like us on Facebook. Leave comments below for questions, or if you have a request, actually. Okay? Let us know. Thumbs up. All right. Thank you.